Hi everyone, my name is Nicole Drucker. I'm currently studying at the University of New England. I'm currently enrolled in the Registered Dietitian Nutritionist Program, master's degree. Today we'll be talking about an ethics case study. I feel as though ethics is one of those topics that has a lot of gray areas, not necessarily black and white. The Supreme Court Justice Potter Stewart once said, "Ethics is knowing the difference between what you have the right to do and what is right to do." So with that being said, we're going to move on to the Code of Ethics for nutrition and dietetics. There are four principles. The first one is competence and professional development in practice, also known as non-maleficence. The second is integrity in personal and organizational behaviors and practices, or also known as autonomy. The third is professionalism or beneficence. The fourth is social responsibility for local, regional, national, global nutrition and well-being, also known as justice. In this YouTube video, the mother and daughter are in a hospital room. The daughter is there visiting her mother, and the mother states, "I hate being hooked up to all these machines. I'm tired and I do not want to be fed out of a bag anymore. I want this tube to be removed." The daughter then replies and says, "Mom, I understand your frustration, but I do not agree. You need the tube to stay in." The daughter then looks to the registered dietitian, nutritionist, and says, "If she takes the tube out with her severe dementia, I would worry that she would remember to eat or drink at all." The RDN replies and says, "Thank you both for sharing your thoughts with me. I do hear your concerns." She then asks, "Mrs. Sweet, do you have an advance directive?" The woman in the hospital bed then replies, says, "No, I do not believe in those things." What ethical considerations were raised in this case study? I would consider the two ethical considerations would be, is the mother able to make an educated decision about her health with her dementia? And then who is able to stand in for her to make these decisions without an advance directive? This leaves the RDN with an ethical decision to make on whether to trust that this woman's capable of making the decision to remove her feeding tube or trust the daughter's judgment in this situation. So just a couple things to consider. What would you recommend? In this situation, there's clearly an ethics issue. The principle of non-maleficence is centered on this code of ethics. I would approach and talk with this woman in a caring and professional manner, especially knowing that she does suffer from dementia. She may not fully comprehend that taking out the tube could actually cause her harm later on. It may be nice in the short term if this tube were to be removed, but however, in the long term, it would be difficult to live her life without it. I would also explain and provide information to the patient that is both accurate and truthful, as well as respecting the patient's autonomy. Due to her dementia, as well as her age, I would try to communicate this information on an appropriate level to help aid her in her own health literacy, as well as help the daughter make the best decision for her mother. I also help contribute in making the decision with the daughter as well as herself to keep the feeding tube because it would affect her overall well-being. As a registered dietitian, it would be my social responsibility to promote my time and expertise to help those to understand what is best for themselves and their overall health. If I were an RDN in this situation, I would first talk to the mother. I would respect her decisions and beliefs on not having an advance directive. I would also explain that it would be important for her overall well-being to keep the feeding tube in. Without the tube, it could be difficult to remember to eat or drink. This could lead to other health complications. I would let the mother express her complaints or concerns with keeping the feeding tube. I would then express that due to her situation and health condition, it would be her daughter's decision. If the woman had an advance directive and strictly stated that she did not want a feeding tube or did not want a certain medical care, we would have to abide by that. But however, there is no written instructions or no healthcare proxy, so that would be put on the daughter to make that decision. Normally it would be put on closer family members. When talking to the daughter, I would let her express her concerns. I would also express to the daughter that she needs to make the decision due to the situation and her mother having dementia, as well as no advanced directive. Without the advanced directive, the mother could be given unwanted medical care. However, in this situation, it would be best to keep the feeding tube in, even though it goes against what the mother currently wants in this situation. It was definitely a tricky situation to unravel, but at the end of the day, you have to take the patient where they are mentally, or if are they able to make decisions for themselves or not, and then talk to the person closest to them that is able to make those tough health decisions. Thank you for your time, and I hope this was helpful.